JATA's been around for over 100 years, starting out with city transit, all types of names, all the way up into our current name of JATA, Jackson Area Transportation Authority. I myself have been here for about 31 years. We love the place, we love serving the community. We have a fixed route service, which is our city buses downtown. We have our paratransit service, which is our demand response vehicles going door to door. And that's our core two services as far as JATA is concerned.
I think it's a critical part of our infrastructure. I mean, it gets people going to where they need to go. It's Jackson's starting to thrive again, and to get from place to place, we're there to take you there.
Our mission is to provide safe, reliable, dependable transportation and related services to the residents of Jackson City and Jackson County. That's our mission, period. Just to get them there safely, to get them to the necessary places, the essential places, anything that they need to get. If it's wheels on the ground, that's what we do. That's what we want to be there for, getting the people picked up and getting them back and forth to wherever they need to get to. You can't get anywhere without transportation. You can't get to the store, you can't get to the doctor, or any place at all, whether it's in your personal private vehicle or, of course, a public transportation vehicle. I think transportation is number one. It's always at the top of the list. It's always in every discussion. It's necessary for every facet of life that we have. Transportation is just, it's essential. It's something that we gotta have. And we think we're really good at it. And we think that we do a good job at it. And that's our business, is getting people where they need to get.
We were in a conference, and Flint did a presentation on their Rides to Wellness program and what it's doing for their community. They started out with, I think, 5 vehicles, and that was 4 or 5 years ago. Now they're up to 130 vehicles just for the Rides to Wellness program. Rides to Wellness is a non-emergency medical transport system. It will take people to non-emergency appointments, like doctor's appointments, follow-up appointments from surgeries. It will also take them to pharmacies or grocery stores, anything that's essential. We're employing professional drivers, chauffeured license, background check, drug tested. We're unlike any non-emergency medical transportation service in Jackson.
So currently with our paratransit, we'll pick a person up and we'll take them to Dr. Smith's. And Dr. Smith will say, you need to go to the hospital and get an x-ray. So the person would call backup dispatch and say, I'm done at Dr. Smith's. And they'd say, okay, but your ride is from Dr. Smith's to home. So if we drop you off at the X-ray center, you don't have a ride back. Now with Rides to Wellness, the ride is a continuation. If the doctor orders the ride, we simply take you from this point to the next point to the next point. And if you leave there and still need to go to the pharmacy, we get you to the pharmacy, get your medicine, and then get you delivered back home. But don't forget, I had to have milk and eggs from the store on the way home, because that's part of my wellness as well, having a good diet. So until we get you back to your destination or origin, your ride's not over yet.
We've been around to a lot of companies in Jackson, and we felt there's a huge need for it. Lifeway's big one, Center for Family Health, Henry Ford Allegiance, they all need this medical transportation because people are missing appointments. There's a gap there between transportation and health, and we feel that this program solves that need.
Rides to Wellness is going to remove the barriers that we have with our traditional services, such as first come, first serve. Oops, I don't have that time available. You got to take a different time. It removes those barriers, and we guarantee you we'll get you there when you want to get there, on time. It's going to eliminate a lot of barriers to the service itself.
I think the impact's going to be great. I think people are going to really love it. We're using brand new cars, brand new sedans. We're not using like what people would think of as traditional transit vehicles like a bus or a van. We're going to be using brand new sedans that are going to be, clean, car seats available for if babies want to ride along in there. Personal care attendants, can come along. Our drivers will sometimes act as a personal care attendant if they need to. We will escort somebody from their door into the car, into their medical appointment, into the grocery store, or wherever they need to get to.
Our health is important to transportation. Our wellness is important to transportation. Our relaxation, just our social life is important to transportation. And I think, if we don't get this in place and get it to the point where people can get the service that they need, especially non-emergency medical transportation, then it limits their quality of life. It does. They don't get to they might miss an appointment. If you miss an appointment, look at the effect it costs you to miss an appointment and the fact that it might impede your health as well.